I've always been athletic, fairly thin, was never an issue, but I did not eat right. I ate terrible, and over the last few years when all my kids have all grown up, my youngest now is her third year of college, I had gotten away from exercise.
We have a program here called the Heart Disease Prevention Program, which takes patients who are concerned about their cardiac risk or their risk for heart disease. We bring them in and we put them through a very thorough evaluation, provide them with what we call a risk score, so a risk assessment telling them what their risk is of developing heart disease.
Went through his program and followed it to the T. I mean, the day we left his office, we went out and bought a bike. We started eating right. I mean, abruptly. The fried chicken was gone, and the dumplings was gone, the mashed potatoes was gone. I haven't eaten fast food in 3 years now.
Everyone should engage in lifestyle modifications. Those who have mild elevations in blood pressure can sometimes control it just by making those lifestyle changes.
When we first did this, my numbers were awful. My blood pressure he was getting ready to put me on medication. I said, oh, wait a minute. I said, just tell me what I got to do, give me a little bit of time and I'll do it. And literally in a month, I brought my numbers way down.
We try to educate everyone on lifestyle. We do have dietitians that we can refer to discuss the dietary portion of it. And then we do some of that in the office between me and my nurse. Really go over those things with you and try to get you to actively engage in those lifestyle changes.
We didn't want to be like that when we're 65 and be a couch potato because we have no energy in order to do anything. So
I feel probably better than I did when I was 25 years old. I mean, it's been we were competing in some triathlons, we run, we bike, we swim, we do a lot. I play senior men's baseball now, which is something I didn't think I'd ever be able to play again because I was just so out of shape. So it's been a drastic change.
So if you do it together, you're more likely to stick to it, So it was much easier when we were both doing it.
And so you take the time to explain things to people in terms that they can understand, and people really respond to that. And I think we do that very well. I know personally I do that well, and I know my partners do that as well too. And that really makes a big difference, I think, for patients and why many of them do like to come back and see us again and spend time seeing us and really let us provide care for them.
Our approach is really to treat each patient as an individual. Patients are not their diseases. A patient is a patient who has a disease, and it's important to know about the patient, about their lifestyle, about them. It's not just cookie-cutter medicine. We really try to individualize care so that each patient can get the best care that we can provide them.
You don't have to look any further than your grandkids for us. I mean, we have 3 and 1 on the way, and I wanted not only to be there for them, I want to be able to go do something with them.